Hello, my name is Scott Windrick, and I'm the Chief Development Officer for Physical Therapy and Balance Centers. Today, I'd like to give you some insights about what we feel is one of the most compelling business models within the healthcare industry in franchising. To get started, we need to better understand the demand for our services. It's no secret that America is aging. In fact, 10,000 baby boomers are retiring each day. Now, couple that with early hospital discharges, a trend towards minimizing the use of narcotics, and the demand for elective surgeries like knee replacements, etc., that creates an enormous demand for physical therapy. It's also a fragmented industry with no clear market leader. In fact, the top 20 providers of PT services capture less than 22% of the market share. Also, healthcare businesses in general tend to command a higher multiple upon sale than most other industries. In this business, you're dealing with professional employees, and they take their careers very seriously. It's a much different situation than managing scores of hourly employees. Physical is also a low-cost business option. Our typical location costs around $380,000 to open, including working capital. And lastly, we don't need fancy Class A real estate. We can go into office space, flex space, Class B retail, etc. And because of that, we can keep our rent costs lower. So, let's frame up the size of the opportunity in physical therapy. In 2018, the industry was estimated at $34.5 billion, but by 2023, it's projected to grow to over $45 billion. Now, before we move on, I do want to take a moment to talk about what physical therapy actually is. Most people think of it as rehab from injuries and surgery, and that is definitely true. However, there are many subspecialties within the industry, like pediatric therapy, sports-specific therapy, and pelvic health. Now, physical does all those types of therapy, but what truly makes physical unique is our approach to balance therapy. Physical is recognized as an industry leader in this category. And this is really important for you to understand because there's virtually no competition in this space. Physical therapists in all their years of education learn very little about how to treat patients with balance and vestibular disorders, like vertigo. And this has created an industry of physical therapists that have no idea about how to treat balance disorders, and that creates an amazing opportunity for physical franchisees. But why is balance and vestibular therapy so important? Well, because falls are the leading cause of both fatal and non-fatal injuries among older adults, and 40% of the US population will experience clinical dizziness or balance difficulty in their lifetime. Now, in many cases, these things are very treatable, but very few healthcare providers know how to treat these disorders. So, a typical scenario goes like this. An older person has been having dizziness or balance issues for some time, but it's not something they experience all day, every day. So at first, they kind of ignore it. Then they mention it to their primary care doctor, but they have no idea how to treat this. So they then send them to a specialist like an ear, nose, and throat doc. The sad fact is that if the condition is not treatable via surgery, the ENT usually has no idea how to treat it either. So many people just go untreated. This then affects their lifestyle and eventually can lead to a fall, which can be catastrophic. The fact is, many of these disorders are very treatable if you know how to diagnose properly and then design a plan of care to do so. And physical specializes in this, which has led to rapid growth for us. Today, we have over 450 open locations across the United States, including 55 locations that we own as company stores. We're not just franchisors, we're also operators of these businesses. Now, as the brand grew, it became important to bring in some other talented people to help grow the company the right way. And to that end, we brought in Brian Belmont as our CEO. Now, Brian's a franchise industry veteran, and as a former CEO of Planet Fitness, he knows this industry very well. Brian has created a culture that prioritizes getting the best patient outcomes possible, while at the same time creating processes that utilize business intelligence data to maximize profitability at the clinic level. Let's talk about the model a little bit. It's a really simple model. There's no cash, there's nothing to steal, we have normal business hours with no weekends, and it's a recurring revenue-based model. The business cycle works like this. Our marketing activities generate new patients. We then do an intake with a new patient and their first evaluation. During that first visit, we design a plan of care. Think about that like a prescription. Following that up with typically about 11 subsequent visits. Then, when the patient's better, we discharge that patient, creating a raving fan, build brand loyalty, and the process starts all over again. One of the benefits of this model is a small staffing requirement. When you open your physical, you need just 3 employees, a physical therapist, a front desk person that we call a client care specialist, and a sales and marketing rep. Now, you can choose to act as the CCS or the sales and marketing rep if you want to, but if not, you'll need to hire for these roles. As your business grows, you'll add additional physical therapists or physical therapy assistants. As an example, if you wanted to build a clinic that produced approximately $1 million in revenue, that means that you would need about 7 employees, 3 physical therapists, 2 physical therapy assistants, client care specialist, and a sales and marketing rep. Now, let's take a look at some of the numbers around the business. Earlier, I mentioned that we have company-owned centers, and our average revenue for those locations is approximately $1 million per location. And remember earlier, I was talking about the example of building $1 million business? I referenced that you would need 3 physical therapists, 2 physical therapy assistants, because on average, the revenue per clinician is $200,000. Our franchise locations average a bit less because many of them were conversions of existing clinics that are smaller than the 2,000 to 2,200 square feet that we recommend for a startup location. This just doesn't allow you to have as many clinicians to drive revenue through the business. As far as the opening costs go, that will range from $180,000 to approximately $473,000. That includes your franchise license fee, which is $49,000, equipment, build out of the space, and everything you need to start a location, including a generous amount of working capital. On average, we estimate the total opening costs around $380,000. Now, as we're nearing the end of our video, I wanted to touch briefly on franchise support services. We have a full suite of support services, including initial training with you and your physical therapist, our real estate team that will help guide you through the process of selecting the right location and negotiate the right lease terms. Our construction and design team will help you design your clinic for maximum efficiency and help you select a contractor as well as oversee the construction process. Our operations team will work with you on your financial planning and goal setting for your clinic. And the marketing team is here to help you with your website, local marketing support services, training, and a ton of really great collateral that's at your fingertips. Following all that up with ongoing field operations and marketing support to help you as your business grows. Over the years, we've been fortunate enough to be recognized by top in class by industry experts. Thank you for taking the time to learn more about the opportunity with FYZICAL.